Hello, and welcome to Everyday Simple Somatics, a podcast dedicated to helping you find healing through your body's natural wisdom. I'm your host, Dr. Christine Baker. So today we are going to talk about this vital somatic skill of tracking. And so tracking is very basic. The idea is just noticing body sensations in the moment. Okay. So have you ever had a therapist ask you, or if you've ever been watching my Instagram and seeing me say, what do you notice inside? This skill is how you answer that question. I can't tell you how many people have kind of like joked with me, either clients or people who follow my Instagram, and say like, what do I notice inside? I notice nothing inside. Or I don't know how to answer that question, And so this skill, tracking, and I'm going to teach you exactly how to do it by the end of today's podcast, is incredibly important to somatic work. Somatic means of the body. And so we have to be able to know and feel what is happening in our body to do it. So that is a huge part of why this podcast started, is to help you build somatic skills over time. And so a little bit about me, for those of you who don't know me, I'm Dr. Christine Baker. I have been working in trauma recovery for over 13 years. I'm also a somatic experiencing practitioner, which just means that I am incredibly passionate about teaching people that trauma is stored in our bodies, and therefore the body has to be a huge part of the recovery process. Hence this podcast, right? Typically, this podcast will be weekly drops, 10 minutes, where we talk about a specific somatic skill offering for a specific mental health problem or relational problem. That will start after what we are currently in, which is our Essential Foundation series. This is a 10-day series just giving you the basics of the nervous system and helping you understand somatic therapy before we get into those more practical interventions. So if this sounds like something you might be interested in, I'd love to invite you to like and subscribe to this podcast wherever you are watching or listening to it, so that you don't miss future episodes and to help other people find these resources as well. Okay, let's jump in to understanding tracking. So, like I said, tracking, the general idea of tracking is just being able to notice what happens inside, what happens in our body, being with it, not trying to change it ultimately, and then noticing what happens next. Bessel van der Kolk has a quote, and I'm not going to get it exactly right, but he says something like, the two most important questions in therapy, as in yoga, are notice that and what happens next. And that's exactly what tracking is. That's what tracking is all about. Okay. And the reason that this matters, the reason that tracking matters, is it really helps us get out of these like overthinking or over analytical spaces. It helps us get out of the spiral of rumination or out of the spiral of overwhelming emotion. Right? Because when we tap into sensation, it is actually grounding us to the present moment. And sensation is quite often it's not neutral, but it is a more neutral thing than out of control thought patterns or overwhelming emotion. And so it's easier to be with, and therefore less overwhelming, and therefore we can stay in the present more. Okay, so body sensations are incredibly important to be able to connect to and understand and befriend, right? So this truly is foundational for doing somatic therapy or somatic work with your nervous system. We can't be of the body if we don't connect to the body, right? And so let me give you some thoughts around different types of sensations that you might become aware of. I'm going to include this in the show notes, and I will also for a moment here put it up on the screen. This is a sensation chart. And so in the same way that many therapists, and myself included, have an emotions chart in their office, I think it's just as important to have a sensations chart, because we need to start teaching people the language of sensation. Okay. So some of the things listed here that I think are helpful to consider as you start getting curious about what you're noticing inside are things like muscle sensations. Okay. So a lot of times people will describe tightness or trembling or pulsing in their muscles. Some of the other things here, achy, crampy, fluttery, shaky. There's all of these different things that can be happening in our musculature that we can notice as we are tracking sensation. Another common one is skin sensations. Okay, so things like itchy, sweaty, dry, flushed, goosebumps. These are all things that we can notice on our skin. Another, and this kind of goes to the next category, another thing that we notice on our skin is temperature. I think this is one of the most helpful ones for people that are feeling a little bit of anxiety about connecting with what's happening inside. I think a really safe one to start with is, can you notice the temperature on your hands? Okay, because typically more traumatized sensation is going to be held in your midline. Okay, so like head, chest, stomach, pelvic area. And that makes sense, right? Because like when we think about really common somatic symptoms related to mental health issues, migraine headaches, heart racing because of anxiety, gastric issues, sexual dysfunction. This is all kind of held in this midline area. And so if you are nervous about starting to get curious about sensation, a great way to start is to start with your extremities. So like your fingers, your toes, your feet, your hands, those are going to be much safer places to start. And if you want to go even more extremity, and this is why I'm offering this as a suggestion, you go skin on the hands. So not even the inside of the hands, not even the musculature of the hands, but the skin of the hands. And it may be noticing temperature, like what is the temperature in the room? Can I notice like the air blowing on my fingers, but my palm feels warmer? They're all very basic ways to start to introduce tracking to your system if this is really new for you. Okay. Another thing that you can begin to notice is movement-based sensations, okay? So if you are someone who tends towards more freeze, and that would be me, I'm definitely someone who tends more towards freeze, I think inviting movement can be really helpful. Because if I'm just sitting here and I'm a person who's in more freeze and someone asks me, what do you notice inside? The answer is going to be nothing. Like, I don't feel anything. And so what would it be like if we could take one finger and just like move up, down? Can I feel that? Can I feel the skin like touching each other? Can I feel the muscles moving? Can I notice like what it feels like in my hand for that one finger to move? So that is a way to help invite curiosity around sensation if you are someone who typically can't feel sensation. So movement could be a way, using fidgets could be a way, or using different kinds of textures. So I think those are all really helpful. There is also, and you'll see this in the chart if you download the PDF or if you saw it on the screen a second ago, there's also constriction and expansion sensations, okay? So typically, trauma is going to be held in more constrictive patterns. And that makes sense, right? Like when we think about like our stomach hurting, there's a lot of tightness. Or when we think about panic, there's a lot of like tightness in the chest, right? When we think about feeling calm and relaxed, oh, my shoulders dropped. That's expansion. Oh, I felt like I can breathe easier. That's expansion. And so on the chart, there's lots of different words for how to describe constrictive sensations and then how to describe expansive sensations. And this is really helpful when we are talking about, like we talked about last week with window of tolerance, learning your own window of tolerance. Typically, more of those constrictive patterns are going to be held above or below your window, and then those more expansive patterns are going to be held in your green zone or your optimal arousal zone. Okay, so I'm looking at my notes here. I think the only other couple of things I want to mention as far as different types of sensations, pressure is another one that we can feel quite often. And that could be feeling pressure from the outside, like I feel like my shoulders are weighed down. It could also be pressure from the inside, like something wants to get out. And so that's one. I think tingling, vibration, these are all kind of like internal movement-based sensations. I already talked about temperature. Yeah, I think this is a really good introduction to different types of sensations that you can start to be curious about. Okay. So now that you've got an idea of what those sensations might be, let me just give you a couple thoughts around how to actually track it. So you ask yourself, what do I notice inside? If you are new to this, like I mentioned earlier, I would recommend starting to notice sensations in your extremities first. You may be super aware of stuff in the midline, but let's start with extremities just so that we don't overwhelm our system and shut down, right? Because a huge piece, and this is a piece of practical advice I had later on, but I'm just going to go ahead and say it now, is to start slow and gradually over time time, increase your curiosity. This is exactly like what we talked about earlier with titration. We want to be very gracious to our nervous system, give it time to start to get used to a new skill, and tracking absolutely is a new skill. And here's the thing, y'all. If you are a person who has lived primarily in fight, flight, or freeze, your body and your nervous system has begun to believe that sensation is actually not safe to be with. And that could go multiple ways, right? Like, it's not safe to be with because it's so overwhelming. Like, feeling that panic is so much and it feels so scary to be with, it's going to take me out. Or sensation is not safe and therefore I shut it all down, which would be more of like freeze stuff, right? And so we have to very gently offer the body, actually, it is safe. And that's why we start with things with no content, right? And so, like, what does it feel like for me to touch the eraser part of this dry erase marker? Like, no content, just curiosity around sensation. That is a very titrated approach to getting curious about sensation in your body. Really trying to stay with neutral language. Like, we're not judging these sensations. These sensations are not bad or good. Even the things that have felt uncomfortable in the past, right? Like, even maybe the tightness in your chest. What if we just said, like, there was tightness and I just noticed it and I felt what that was like to be with that tightness. I noticed which muscles were involved. I want you to just get curious about as much of it as you can. How much of your chest was tight? Was it just in the middle or was it the whole chest? Like, just noticing as much as you can and then saying, and as I'm with that, what happens next? Right? So I think those are the couple of little tips I would give you for tracking. Like, how do I do it gently? Baby steps, use neutral language, get curious about what happens next. And then also knowing when to pause, right? I would say, this is what I tell my clients all the time. The goal is not to overwhelm your nervous system. So if we're talking about a SUDS scale, which is like a thing in the counseling world, subjective units of distress scale, ultimately, how uncomfortable do you feel of 0 to 10? And 0 is like, I'm totally fine. I feel neutral. 10 is like, I'm having a panic attack. I need to go to the hospital. We never want to get above a 6. That's what I say to my clients all the time. We never want to get above a 6. So if you feel like you're getting close to a 6 or are at a 6, let's pause and take a break, you know? And so I would say the same thing to you. Like, we never want to get above a 6. So if you're starting to be with sensation and it feels like too much, you're getting above a 6, let's just take a break, you know? That is okay. Because remember, goal is to retrain our nervous system to come back to gentle rolling hills. And if I, through my sensation tracking, am letting myself get to a 9, well, then I'm outside of my window, and that is showing my body that this is not safe, right? And so if I want to teach my body, no, this actually is safe, then it needs to be gentle rolling hills, okay? So I hope this was helpful today. Tomorrow, we are going to take the next step with tracking, and I want to explain to you guys how tracking actually helps us stay in the present and why that's so important for mental health and nervous system regulation and trauma recovery. So tracking, being in the present, and why that matters ultimately. So I hope that you will join us tomorrow for that. If this has been helpful, I'd love to invite you to like and subscribe to this podcast wherever you are watching or listening to it. And then if you'd like to dig in a little deeper, I'd love to invite you to our Somatic Wellness Collective. This is my online monthly learning community where we just really dig into these concepts and learn how to apply them to our own lives. It is an incredible group of men and women, and I just feel honored to get to be their guide in all of that. So remember, your body has innate wisdom. We just need to learn how to listen, and that's what I'm here for. I look forward to seeing you next time.